Good evening, everybody. Today is Friday, May 29th, 2026. It's 6 o'clock p.m. Eastern Standard Time. Thank you for joining Rex Sisters on this Friday evening. I appreciate everybody switching up for me. I have a bunch of doctor's things coming up. As a reminder, next week we will be live from 3 to 5 p.m. Eastern Standard Time. And then we'll kind of figure out what goes on from there. But if you wouldn't mind hitting the like, follow, comment respectfully, share, and set your notifications, we would greatly appreciate that. Crazy B and I didn't get a chance to talk today because the wild man was being the wild man now that he's walking. So he figures he doesn't have to nap either. I guess he's old
Yep.
enough to skip a nap.
I mean, if he's sick or fussy, over the top, I'd make him take a nap. But I wouldn't be like mandating a nap every
No,
single day, every day on schedule, military style.
no, but a nap is warranted every day at 1 year old. So I don't care what time it is, he will take a nap.
As long
Or
as
he
it
can
ain't too
play
close to
quietly.
bedtime.
He has a as long as he doesn't have to nap, but he will play quietly in his pack and play.
Mm-hmm.
At least for an hour.
Yep. There's nothing wrong with that.
No, because I'm not his entertainment, despite what he may think.
Like the cats,
You
he
know?
thinks he owns you, not the other
Yes,
way around.
exactly. Between the cats and the dog and him, I don't need 4 other little beings telling me what to do. So,
Hi, Blue Rose.
hey, Blue, what's going on here? Crazy bee.
Not much. I've just been chilling today. A
Mm-hmm.
little nauseated, slightly headached, but not horrible. So,
I'm telling you, I can't shake whatever's going on. It just seems to be getting a little bit worse each day.
yeah, that's not good. That's not good at all.
No, but we're living on the wild side.
I wouldn't call it wild side. I'd call it playing Russian roulette with God.
Well, when he's ready, he's ready. Right?
He may not appreciate you doing this.
That's why I said I ain't going nowhere, because they're like, nope, don't want it. Either way.
Oh, I need to share my screen with you before I forget.
I was hoping you wouldn't.
Uh, it's one of those days, I promise.
Mm-hmm. So hopefully, as we said earlier when we started this with the Hantavirus, and now it's turned into Ebola, you'll see by the end that I think I didn't find this what we're going to hopefully get to by the end of the day. And I'd like to kind of wrap this up if we can today, Crazy B, so that we don't go to drag it into another week.
Mm-hmm.
Perhaps we should start with that first, the Loomer stuff.
Those are the last two posts, I believe.
Mm-hmm. Yes, ma'am.
I can
Maybe
move
we'll
those to the
start with those.
front since
Yeah,
they're not
maybe we'll
that
start.
serious.
Yeah, maybe we'll start
Oh
with
yeah,
that,
I
and
saw about this. That's what people get. Sorry. I saw that over on YouTube, and all I could think is that's what people get for being that dumb. People don't know what
uh-huh.
I'm talking about, but that's my personal opinion. Hmm.
Well, and so as we researched this, then I came across what we're gonna this Laura Loomer post, and Crazy B and I've been talking about her back and forth. You know, is she a whack job? Isn't she? Is she? Isn't she? And there's varying degrees of whether she's on point or she isn't. And like all of them, I think she probably has a place. Is she any different than Tucker, Candace, any of them? Uh, I don't know.
Depending on
Perhaps.
Tucker or Candace, they're not high on my I'm going to trust what they're saying list. I
Exactly.
trust Alex Jones more than I do Tucker Carlson and Candace Owens.
Hmm. Hmm.
And again, Alex Jones tends to absolutely exaggerate how bad some of this stuff is. And yes, it's jacked up. Our government's doing it, but the way he presents it is way over the top. And I know it's on purpose to get people to pay attention.
Right.
But like, that's where I stand with that. But as for Laura Loomer, oof, it's a 50-50. I still don't know where to place her.
I know, neither do I. So, she posted today that she's been warning about an Ebola lockdown in the US since 2021. See her tweet below from 2023. I hope you're all ready for it to soon be announced that Ebola is in the United States of America. It will likely be announced between now and the week or second after the coming World Cup in the US, which is in 14 days on June 11th, 2026. And I would like to argue Crazy B and I have been saying that since we started this. How many Africans will be traveling to the US for the World Cup? Too many. Today, the US State Department quietly announced they are allocating another $80 million towards the Ebola response. With this new $80 million commitment, the State Department has mobilized more than $112 million in bilateral foreign assistance for the Ebola response in less than 2 weeks.
And how
There's a
much goes
reason
to the
for this.
warlords?
There's a reason for this. It's coming to America, and they need to at least show they tried to stop it. But the thing is, Ebola is already here, as I've been reporting for the last 2.5 weeks. You'll
Like
see,
COVID was here
book,
before they even acknowledged the lab leak.
yes, bookmark this tweet, which I did.
I was gonna say I
So
can
this,
bookmark it. Hold on. Oh yeah.
yeah,
No, it doesn't show it bookmarked here.
no,
Is it bookmarked under your
well,
account or your private
yeah, it's
account or the
under
Rex
my,
Sisters?
yeah, it's
Oh,
under
okay. Well,
my account.
I'm bookmarking
Yeah,
it here too.
uh,
Okay, so
so the first thing we had up, I pulled you should have the response update. That's
uh,
this piece.
this
She
little
cut it off.
post here.
Yeah, but I thought I sent that. I think you can click on that Crazy B.
Well, we
Just
got
click
a
on her.
couple of
Click on her
things.
link. Yeah, go ahead. Click on her link.
Where is her link
Oh,
to
you know
it?
what? Go. Yeah, go ahead. Up. Uh,
Was it this
ah,
one? Yeah.
that's it. Okay. Uh, so this is as of May 28th. This is of yesterday. And what I find fascinating about this now is, so look at all the places we've been looking for Ebola at. And now the State Department's giving an update. Why isn't the CDC updating? And, huh, go figure. And I recognize different departments, but isn't there like a coordinating or a circular type thing that we could? Because the CDC has jack shit still on their website that's updated
I
as
think
of
the
today, as
State
of yesterday.
Department is at a certain point they have to step in and start coordinating as well because it has become international. So the State Department is going to be involved somehow. I just don't
Mhm.
remember exactly how or why. They were really big and heavily involved during COVID too.
Right.
I'm
Well,
trying to remember. I'm
I don't
reading
remember.
slowly. This is having to deal with some various regions of the DRC. I have a feeling the State Department's involved because of all the war wars and the fighting, and half the money isn't more than half the money isn't getting to what it's actually supposed to go for. That could be why the
Hmm.
State Department's stepping in. Is
Perhaps.
they're going to have to start putting this money towards the people and not towards ammunition and weapons. And fuck their war. These people are more important. That could be why the State Department's stepping in.
Hmm.
That's the only thing I can really come up
But
with. It's a war torn region.
right, and they're going to try to expand the clinics and improve treatment capacity, which we know that they can't handle what they have right now.
Mm-hmm. And they can't even really expand anything without the warlord's permission. And it depends on which
Right.
warlord and which day of the week and whether he's in the mood to deal with you or not.
Exactly.
So, yeah.
All right. What else is in that document there?
Not
Anything else?
much really. Just basically breaking down how much of what's going where.
Oh, by the
Or,
way,
yeah, basics.
need
Hmm.
to forewarn you. If I scream, that means there's because black ants have now invaded the bedroom. So, just
Okay.
saying, just you're forewarned.
Yep. It's all right. Last time that happened, I made it into a short and put bugs crawling across the screen. You know, but
There
then
you
again,
go.
it
And
turned
it's
out it
just
was my
that time of year.
cursor that you freaked out about. But
Right.
it is what it
Exactly.
is.
Right. It still works, doesn't it? Oh yeah,
Yes.
and these suckers are huge. So I'm telling you, it's when you glance over and see a huge black ant on your water, then you know you're in trouble.
Yeah. They do tend to get into everything.
Uh huh.
And killing
It's
them
I
doesn't stop the rest from coming in. You got to
mm-mm.
mask that scent that they leave for the trail. You got to mask it all and hope they don't find it.
And just the bleach spray. All
Oh.
right, what we got next?
Um,
Well, what
was
else is
there
in her
more in
post?
her tweet?
Yeah, there's
Or
more. Yeah, there's more in the post. Go down.
and that was this
There we
one.
go. Hmm. So it appears that was Moderna involved with this,
Moderna's been
as I've been
working on a
reporting.
vaccine for this kind of stuff for some
Right.
time.
And this is from September 25th of 2023. She writes, as I've been reporting for the last 2 years, the US government has been quietly funding and allocating resources for Ebola vaccines and PCR tests. They're looking for a real pandemic to shut our country down with ahead of 2024, one that they
Hmm.
would be able to halt the 2024 with. And
That actually doesn't surprise me. A PCR test is the only way to actually test for a viral infection. It's
mhm,
there's different like the PCRs. There's it's a PCR test, but each test is sensitive to certain antibodies that tell us which one we're dealing with. And so that's why you can have a rapid strep test. It's a PCR. It's
right,
done quite quickly right there in the office. Your flu comes back within a matter of minutes. It's just a PCR test. Um, so I don't. Yeah, the COVID ones were wonky because, well, COVID was also manipulated in China, and hence we didn't have an accurate one to go off of for trying to figure out which one it was. But yeah, they've been trying to deal with Ebola for some time. Yes, Moderna wants to make a vaccine for it. And of course, in 2023, the mRNA vaccine was the everything and savior of all the viral infections in the world at
hmm,
that time. So, of course, Moderna is going to talk about making an Ebola vaccine out of that. And obviously, it didn't go anywhere.
right. Why don't you pull up what the current map looks like?
That's
Is that separate?
this one.
Yes.
Okay. This is every outbreak since 1776.
Hmm.
It was
No. since May of 1712.
1976. Um,
Yes, I
no,
know you're hoping for the 250th anniversary, but
I said it
still in May.
backwards. I'm sorry.
Mhm.
So, yes, this is the 17th Ebola outbreak in 50 years. And they are becoming more and more common. And they are getting more and more deadly. Go figure. Um, the WHO has declared it a medical emergency, a health emergency, whatever. There were 2 imported cases in Uganda. Uganda has now confirmed 12 cases, up from 2 weeks earlier. Okay. So they went from none to 12 in 2 weeks. Okay. Yeah, we know there's no licensed vaccine or proper treatment because, heading it off and treating it properly just it's much better to research on how to turn it into a weapon than how to save us from it.
Exactly. Yep.
So there's potentially 35,000 global cases since 1976. I don't know why I'm wanting to add 17 to it. But again, when you talk about this as a globally thing, it's mostly been contained to Africa. I don't think it's ever been on many of the other continents.
No.
I don't think it's ever really been anywhere but Africa. I mean, I'm not an expert. I'm trying to remember off the top of my head, and I have not been feeling great. So let's see. On May 16th, the World Health declared a new outbreak, blah, blah, blah. We know this.
Yeah, we know most of that.
Yeah, I'm looking for... Oh, yeah, where our regulations are... so the health regulations and only the 8th such declaration since the framework's modern adaptation in 2005. When they consolidated power and started telling all the countries how to respond instead of letting the countries decide for themselves how to respond. Yeah, got it. Okay, so latest figures as of May 19th. And again, I've heard so many different numbers according to this.
We have new ones. Yeah, ignore that. We have new ones.
Oh, we have more new ones?
Yeah, we have new ones. But there's the map that I wanted everybody to see since...
Wow, that's such a global hit. It's mostly Africa. Part of more upper Africa, and I don't think anyone actually brought it to America, or if they did, it was contained quickly. But I'm sure because an American citizen died, they're claiming that it hit America, but I don't recall it ever being in America. So, yeah, basically, it's all in Africa.
Right.
And they're literally breaking down day-to-day movements. And here's the thing. April. We know it probably started in March.
That's what
and it's another hemorrhagic illness. Yeah. What are you looking for? Oh. I guess they're going to cut the grass finally. They need the key from my keychain to cut the grass. So yeah, basically this is a straight up timeline, literally.
I've heard of people having to cut the grass with a pair of scissors, but never with a key before.
No, because we have the electric mower that we use. It has a little, like those treadmill keys. It's the same damn thing.
I got you.
It's raining.
Yeah. Oh, because the last 2 hours that you've been home and it wasn't raining.
Quiet down.
Oh no, wait! I take that back. You got home at 1. So from 1 o'clock until now, that it wasn't raining. And I'm the one who nags.
True.
I just point out what they do wrong. Anyways, back on focus. So yeah. This is here. It says where the outbreak started and why it spread. It spread because one, that it takes longer for the virus to incubate, and that means people don't know they're sick until it's too late, and by then they've already passed it to other people. That's why it spreads so quickly, and well, what appears to be quickly, even though it's actually not quick. Where it started, well, the mines and commercial traffic. Oh no, they're saying it's spread because of the mines and commercial traffic and lack of security. Okay. What water source did it come from this time?
Right.
So it's saying the current epicenter is at a province of high traffic mining area. Okay, yeah, but what is the water source? Ebola usually comes from a water source.
Well, I would imagine in the mining field that it would have something to do with it.
Yeah. So as of May 15th,
Yeah.
Go ahead.
I was just going to say in 10 days it's spread to those cases.
In that region. Then when you go to the other regions, Germany, they're counting something in Germany because of it was an evacuated American who actually got sick in the DRC.
Right.
This is that does not mean Ebola is running rampant there. It means they have a quarantined individual there.
Scroll back to see a little bit further on, and I take great issue with that in that enhanced screening. So you're going to take their temperature, you're going to talk to them. Okay? That's fine.
It says partner agencies implemented a Title 42 style entry restriction on May 18th for travelers from the DRC and Uganda. Departure, airport screenings on arrival, temperature checks, and a 21-day post-arrival monitoring are now standard. Oh no, they're just not taking their temp and letting them through. They're holding them for 21 days before they can come through. They are doing a little bit better than what they did with COVID. I mean, we were all told to stay home, but people were still illegally crossing the border. You still there, Dee? Uh-oh. Hold on. Did you mute yourself? I lost Dee.
No, I lost you.
I was looking at the screen. You were still there, but I could not hear you.
Likewise.
That was very strange. Oh.
I thought maybe we got kicked off of YouTube.
Well, that wouldn't stop us from talking in Discord or on Rumble or various other ones.
Right.
But I was pointing out how they are doing the 21-day hold in the neighboring country. So that way, it's more than just a temperature check and asking questions. Actually, it's more than they did for illegals with COVID.
Okay, but is that for Americans as well?
Anyone coming from that region.
Yeah. Well, yesterday we read that it was Americans could come through. So this is from Laura Loomer's thing, isn't this? Is from
what date
is on here?
That's what I was just going to look. May 20th.
No, 20th. Okay, so
there's been some changes since then.
Correct.
Yes. And last I heard, as long as you weren't from any of those regions in Africa, you could just come straight in. But then the question is, if other countries are laxed and you get exposed in one of those countries where someone was visiting from one of those other countries and you come into contact with each other, I mean, it's a rare possibility. I mean, we're talking astronomically rare, but it's still a possibility. I mean, we would have to literally close down all travel, strand all Americans no matter where they are, until Ebola clears up, if we really wanted to be 100% secure.
Well,
That would be the safest way to do it, is absolute no anyone from anywhere. Doesn't matter if you're stuck in North Korea or China for a 1-day visit, you're stuck until this clears up. That's the safest way we could do it.
if it's as serious as they say, is that far-fetched? But she believes that they're already here, so.
Well, and I've said there is an actual chance it could be here. I mean, again, we had people exhibiting symptoms of a rare upper respiratory infection that, or not rare, but unknown upper respiratory infection in late 2019. And they're like, we don't know what it is. This is new. It's not anything on our list. Was it pneumonia? Was it strep? We've been through this. And a couple months later, oh, COVID. There's no way it was here before 2020, except we have a shit ton of cases that absolutely prove otherwise. So,
right.
And this is me talking about my own personal medical records and people I know whose medical records, it's not medical advice, bite me. Sorry.
I was just getting ready to say for our platforms out there, this is for educational purposes.
Yep.
On the current information that we have available, it's out there from sources, publicized sources, so. Mm-hmm.
And we're questioning everyone. Yep. We're questioning the right, the left, the center, everybody in between. Everyone except God Almighty himself is being questioned. But I've questioned God on a lot of things. And, well, I think that's why I'm still here. He hates me.
And it's...
All right. Is this being weird? Okay. Whatever. I don't know what's going on with my mouse. They're calling it a serious concern. This is a lot down. That's not nearly as verbally scary as what they described other ones in the past as.
You've been gone for the last 4 minutes.
What? What do you mean? Which platform? No, we're up on YouTube. We're up on Rumble. Twitch is showing strong with 2 followers. And X is showing live as well. Oh. I lost D again. What is going on? One moment while we deal with whatever the heck is going on. I have a feeling she might be having to uninstall and reinstall it. This is where it is. One moment, please, while we figure this out. Right? How bad is that rain outside? Doesn't seem that bad. Yeah. Uh-oh. I'll give it a couple more minutes and then I'll retry calling her. I don't know what's going on. This is, well, not new to us. I'm not surprised at the very least. I know we're showing live on all the platforms, so don't get it. I was able to hear her, but she could not hear me, evidently. Huh. Oh. Okay. I'm going to give her a quick call. Hold on, folks. Oh, and now she's typing. Okay, let me give her a call and see if it'll let her in. Okay, can you hear me? That was very strange. So you're able to see and hear still? Huh. I heard you say we've been, that you haven't been able to, we haven't been, up for like 4 minutes. And I'm looking at all the platforms. I'm like, no, we're still live across all of them. Oh, wow. That's wild. I could hear you up until the point you hung up. Let me unmute so people can hear you. Yeah, she was told she'd been disconnected. Well, not disconnected. Is it your weather? You got good weather or bad weather?
Perfect weather.
I have no clue then.
You see it on the screen.
That is really bizarre. I heard you say something about disconnected for 4 minutes.
No, I said I couldn't hear you for 4 minutes, whatever you were saying. And as soon as I said that, then it went to then I got the screenshot.
That is so strange. Because everything's been normal, supposedly. Well, that's weird. Mm-hmm. Chalk it up to a ghost.
There you go.
Alright. But I was saying about how the wording for this is not as inflammatory as what was used during like COVID or swine flu. It doesn't seem to be trying to scare people.
Not yet.
Well, maybe because it's not serious yet. It's not a reason to yet. And they're saving it for when it does happen or in the event it does happen.
Mm-hmm. If she's right. Or as I said, who's coming for the FIFA Cup?
Or it may be a nothing burger and we get lucky and it isn't here.
I hope so.
I would really love that to be the case. Do I trust it to be the case? Prepare for the worst, hope for the best, and grab an umbrella because there's always going to be a shitstorm.
Mm-hmm.
That's the way I live life. Ebola is not a single virus. The genus, blah, 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 because I can't pronounce anything for shit today, contains 6 recognized species. Oh, so like flu A, flu B, flu 1, 2, 3. Oh, let's go into the hepatitises. How many were there? A, B, C, D, E, F, G. I got a lot of hepatitis out there. They're all recognizable.
Mm-hmm.
This is okay. This was biology for me in college. Okay, just in case people don't know, I knew this shit while taking advanced biology. Um, I don't know why they're trying to make it sound like it's scary. Yes, there are various variants of Ebola. And the current outbreak is the one that sounds like Bundy Boogio. Bundy Bugyo. I don't know.
You mean like it sounds like Peter Buttigieg?
That could be an option too.
Mm-hmm.
The Buttigieg virus. Okay. It is the rarest of the 4 human pathogenic species. And it's not the first time. It was discovered in 2007 during an outbreak in West Uganda. And that was one of the first times they tried screaming about it. Oh my God, Ebola! Sorry, my voice is cracky. It has caused only 2 prior outbreaks, 2007 and in 2012. Case fatality is around 30 to 40%, which is lower than the Zaire Ebola virus, but still extremely high. I thought they said it was the worst one.
So did I.
I swear I've heard news outbreaks. Oh my God, this is one of the worst ones. It's the worst out there. We haven't seen it in like a decade. But it's still lower than the Zaire one. But I thought they said it was the deadliest outbreak of all of them. Maybe that's why we can't get accurate numbers from any of these agencies.
Probably.
Okay. Yeah, I wouldn't be surprised. There's 2 licensed Ebola vaccines that are for the other one. That's the RVSV Zevbov, and that one, which is a 2-dose regimen, both target Zaire Ebola virus. Cross protection against this virus has not been clinically established, but is a possibility, and this study would go and show that people who had been vaccinated for Zaire, who were resistant or had lesser effects of this one, it is a very good clinical study to research, my personal opinion. I'd be getting some testing because the 2 monoclonal antibody treatments also target Zaire-specific epitopes. You know, this is again the monoclonal antibody treatments. Those sound familiar. I thought we were told not to use those for viruses. Weren't we told that those weren't allowed for viruses, the monoclonal ones? That
I believe. Don't hold me to that, but
I swear I remember being told that the not to use any of those, that none of those would work with the other virus we've battled. But it's okay to work on a worse virus. Okay. The response is relying on classic outbreak containment, isolate, contact tracing, and safe burials, rather than vaccination. Well, yeah, because vaccinating for flu B is not going to prevent you from getting, I don't know, let's think of a similar. Okay, if you vaccinate for the modern flu B, it's not necessarily going to protect you from the original Spanish flu of 1918. So, you know, there's a difference. But the Ebola cases worldwide since 1976. I'm going to learn, I promise. The Sierra Leone, is that 14,124 people in case-wise? Let me enlarge this.
Yes,
It's so
is.
damn small. Wow, but this is the worst one ever. Liberia was 10,675 cases. The Democratic Congo was 4,596. This is since 1976 to 2026. So 50 years. And they're talking like this is the worst ever? Um, um, um.
All right. Why don't we, are we still on the map, Hickey?
Oh, I thought I was sharing my screen with you.
Yeah, okay, we're good.
Yeah, we're still on the map one. And then here's the other ones. Wait. So out of 10,675 cases, only 2,738 died. But Uganda, from 2000 to 2026, oh, then where is it? Oh, they've only had 814. Oh, yeah, this is not the worst. It comes in third. Even though it's had the most outbreaks, it still comes in lower than the others. Liberia got hit hard. I mean, a lot of these have had more deaths than the current one we're looking at. I mean, some of these are 0 deaths. Since 1989 to 2015, due to imports, a Reston strain and Macacus led to 4 outbreaks, 11 cases, and 2 deaths since 1989. UK, Spain, Italy, and Germany have each had 1 case, 1 outbreak, and that was just from 2014 to 2015. So,
have you heard of the $250 bill?
Yes, I heard of it. I know, trolling on a whole new level. Go.
But what happened to the $200 bill? Like, why are they skipping 200?
Can I go back to what I'm doing?
Why are they skipping 150?
Oh my God, go do something productive.
Yeah, asking questions that you need answered.
I'm sorry. Ignore my son. So it's looking like this is actually not the worst case ever, despite what the media is trying to say.
Right.
Alrighty. Was there anything else up on this one, or?
I don't think so.
Okay. Which was next?
I believe the WHO.
Okay,
Wait.
so yeah, this one.
Yeah, wait. Yeah.
I think this is the WHO one.
Yeah, the 0527. Can you enlarge that a little bit?
Let me do what I can.
Okay, so the Ebola outbreak in the DR Congo collides with conflict. I need you to scooch that over for me to the left, Crazy B. I can't see it. More, please. You might have to wipe out my side of the chat.
I can make this a
There you go. That might be okay.
Okay.
The Ebola outbreak in the DR Congo collides with conflict and hunger, who warns. Okay, so Director General Tedros said that the Ebola virus outbreak in Ituri province was spreading in an environment where insecurity, attacks on healthcare facilities, and population movements were making it nearly impossible to trace contacts and isolate cases. We cannot build community trust or isolate the sick while bombs are falling, he said. What bombs?
Well, more grenades.
Okay. We did all that. There's reported now, as of yesterday, actually the day before, since Wednesday, over 1,000 suspected cases with more than 220 suspected deaths.
Yeah, because they got to go from
Neighboring,
March and didn't bother telling anyone.
right, in neighboring Uganda, they've reported 7 confirmed cases, including 2 healthcare workers, and 1 is confirmed dead, who warned that the outbreak was continuing to spread geographically, while evidence of ongoing cross-border transmission. The outbreak is centered in Ituri province, but has now spread across the 11 health zones, with cases also reported in North Kivu, including the Tembo and Kamo and South Kivu, according to the UN Children's Fund, also known as UNICEF. Health officials say the virus is spreading through family clusters and health facilities, with infections linked to caregiving, family gatherings, and unsafe funeral practices. It's a beautiful looking country.
Oh, yeah, if it weren't being destroyed by
Yeah,
idiots.
right. Conflict undermining the response. Efforts to contain the outbreak are unfolding in one of the most volatile regions of eastern DRC, where humanitarian access has long been constrained by conflict involving multiple armed groups, including the Allied Democratic Forces, ADF, CODECO, CODECO militias, and the Rwanda-backed M23 armed group. A December 2025 report by the UN peacekeeping mission MONUSCO documented persistent violence across Uturi and North Kivu, including attacks on villages, health facilities, and displaced communities that killed hundreds of civilians and forced widespread displacement. Active fighting and restrictions imposed by armed groups also hampered humanitarian operations, limited civilian movement, and disrupted access to essential services. Hunger and disease collide. The violence has compounded an already severe humanitarian crisis, according to the latest analysis by IPC, the UN-backed Global Food Security Monitor. Nearly 10 million people across Ituri, North Kivu, South Kivu, and blah blah are facing acute hunger between January and June of 2026. At the national level, an estimated 26.5 million people in DRC are experiencing high level of acute food insecurity, and there's no reason why that should be going on.
It's the
Hunger,
people in
yeah,
charge.
hunger and disease are old companions, Tedros said. People weakened by hunger are far more vulnerable to infection. Poor roads, damaged infrastructure. Who said conflict, poor infrastructure, and insecurity were limiting the movement of aid and access to health services. In many affected areas, health facilities are either non functional or operating under severe constraints due to insecurity, Tedros said. Poor road conditions further restrict the movement of goods and humanitarian assistance. Children are also being heavily affected not only through infection, but through the disruption of health, nutrition, and education services. UNICEF warned. It added that children affected by Ebola outbreaks are faced the loss of parents and caregivers, while stigma and fear can leave them isolated within their communities.
If they'd get rid of the freaking corrupt government.
Building trust. Who is at the center of a UN system wide response, deploying emergency personnel, medical supplies, and funding to help contain the outbreak? The agency is also working with community leaders in Bunai to build trust and counter misinformation. It has developed public information messages and awareness materials adapted to local contexts and translated into local languages for wider reach. Community trust is the foundation of effective public health response. Without community support, outbreak control measures cannot succeed, said a WHO spokesperson. Calls for ceasefire. Tedros appealed for an immediate ceasefire to allow humanitarian and medical teams safe access to affected communities. Stopping this Ebola transmission depends entirely on humanitarian access, he said.
Those leaders are never going to let that happen.
Exactly.
And that's it.
Right.
Yeah, those warlords, they're making too much money off of all these agencies who are desperate to get in and help those poor people. So they're just like, yeah, screw you. Until you give us however many million off the top, you ain't going nowhere. And then once you get it in place, we're going to extort you even more.
Right. Can you click on that map there, Crazy Bee?
It won't let me.
Okay.
Yeah. I'm a little bit irked with the way we're sinking money into a system that, and they're like, oh, it's food insecurity. No, it's a warlord who won't let proper stuff be grown here, won't let people from the outside come in, and yeah, it's like, oh my lord. They're sugarcoating the pile of dog shit and trying to sell it to us as candy. Up next is that video about it where they sugarcoat it some more, I believe.
I think you might be right.
Okay. What I did for this one is I sped it up a little bit and cut out as many long pauses. I got it down to 10 minutes and 49 seconds.
That'll work.
Okay. I know it was originally closer to 14 minutes, so. All right. This, I guess, is what's going on the ground over there, as nicely as they can show it, I believe.
Mongwalu Hospital near the DRC's eastern border with Uganda is at the center of the Ebola outbreak. The facility was attacked by young men demanding that the bodies of relatives who died be handed over to them. Medical staff were forced to evacuate the site, and tents put up by the aid agency Doctors Without Borders were burnt to the ground. The hospital's director says the violence has made an already desperate situation even more difficult.
There has never been an epidemic of this magnitude in the region. There have been rumours, people are saying the disease came from this or that person. And now they have turned words into actions. By burning down the facilities, they're slowing down our response to the contamination and our efforts to break the chain of transmission.
The bodies of those who have died from Ebola are highly infectious. With no vaccine or treatment for the latest strain of the disease yet available, doctors and nurses treating cases are themselves in danger of becoming infected.
The medical staff here are not trained to care for Ebola patients. That's why they're at risk of contracting the disease.
They looked pretty well trained to me.
Mm-hmm.
They looked like they were doing a good job disinfecting themselves off after handling the dead. I think they're just full of crap, and yeah, on that part. I've said it before, and I'll say it a million more times. An x-ray taken in China is done the almost exact same way as in America, but the difference is the language and the mathematic measurements, standard versus Americanized, or metric versus standard. How you draw blood is the same across the world. How you listen to a heartbeat, how you check blood pressure. It is pretty standard across the world. How you disinfect after being exposed or how you precautionarily prevent exposure to a virus is also the same across the globe. So, for them to sit there and make it sound like because we're from a different country, we don't know how to wash our hands, cover our mouths, and don't play with dead bodies that have blood from every orifice. Like, yeah, I just wanted to point that out. Common sense is the same across the board. It's just they need money desperately. But the more we send, the more that they will not get. They will always get the same amount of nothing or next to nothing because of the government. But anyways, let me shut up and hit play.
Right.
Unless you wanted to add anything to it.
No, you're right.
I'm rambling.
Since they don't know how to protect themselves.
Several patients absconded during the fire, vanishing back into the local community, and that has deepened the climate of fear. Health workers are running information campaigns in the hope of gaining people's trust. And in the city of Bukavu, there's been a surge in demand for hand-washing stations and other hygiene installations. Nonetheless, the World Health Organization is warning that the Ebola epidemic is outpacing efforts to contain it. The situation will get worse before it gets better.
More on this, we're joined now by Christian Katza. He's the director of Doctors Without Borders Germany. Thanks for being with us. Christian, the head of the World Health Organization says at the moment the epidemic is outpacing us. Have authorities underestimated the danger of this Ebola outbreak?
I don't think they've underestimated it, but it's because of the nature of the extent and the circumstances of the outbreak that makes it going out of control currently. Authorities have tested for Ebola virus, but they haven't tested for the current virus. And therefore, the outbreak went undetected and made it very difficult to intervene initially. Now we know which virus we are dealing with, and therefore we hope that there is still a chance to bring that outbreak under control, even though we assume that the outbreak has spread, and we are talking of probably more than 1,000 infected people right now.
We keep seeing those numbers of infections and the deaths rising. What do medical teams on the ground need right now to get this epidemic under control?
So what we need is actually supplies for protective material. We need tents and other construction material to be able to isolate patients. And we need a lot of staff to actually bring in community acceptance and infection control in communities where safe burials, the follow-up of contacts, etc., is essential to curb the outbreak. And what we also need is much more diagnostic capacity, especially in some areas of the Democratic Republic of Congo, where the central lab in Kinshasa is still to confirm samples taken, and that travel time and gives huge delays, as we have other diseases in the area which also bring fever and symptoms similar to the one of the virus, of the Ebola virus, and therefore a quick detection of those cases who are actually confirmed positive of Ebola virus would be very important.
Now, there have been several attacks reported on healthcare facilities in the affected area. Why are some people there angry at the very people who are trying to help?
There's a number of reasons, including the whole area we are talking about is actually prone by conflict and displacement. So people are by nature very careful to trust authorities. The second one is that actually healthcare facilities in the area are not very well functioning. If people seek healthcare there, they often have to pay, and the care they get is not often good. So there's some people try not to go to into health facilities. And the other one is actually that, and we have seen it also in the pandemic in many other places, that people don't trust necessarily what comes from central government or authorities in terms of information.
It's funny that consistently across the world, no matter what, people don't trust the authorities.
Exactly.
Throughout history, and still to this day, across cultures, language, nobody trusts the government.
You're right.
Oh, God, I love it. Oh, but they tell us to trust the government. Okay.
They don't believe that the disease is really there, and they prefer to continue with their life and do not see that major outbreak impacting their own lives. So these three factors, I think, play a key role in the beliefs of people, and that's what I meant with community engagement. We really have to see that we get the message across that this disease is fatal and can impact everybody, but there is ways to prevent spreading, which includes just avoiding body contact. So it's a bit easier to prevent transmission than in, for instance, SARS-CoV, what we have seen.
Okay, so if it's easier because you literally have to come into physical contact with the body that has the illness, so it's easier to prevent. why are they making it sound like everybody and their brother is going to catch it just by being alive?
Good question.
It's like conflicting from the, and then get it, you touch someone who's had it, it could take so many weeks, and then you show symptoms, by then it's too late. But if people were already washing their hands, or medical providers there are doing what they're supposed to do, but then taking the warlords, stealing money, not enough supplies. I don't think it's always the people themselves who are having a problem. I think it's a combination of everything.
Right.
I mean, I feel bad for the people, the civilians, not the idiots in charge.
Around the globe a few years back.
Well, the virus does indeed seem to be spreading. How high is the risk of the outbreak spreading to other countries? There are already cases reported in Uganda.
Yeah, so overall, as I said, the transmission is not that easy, so that will make it almost impossible for it to become pandemic. But we will see numbers going up. Definitely, we will definitely see other parts of the Democratic Republic of Congo seeing cases because people are very mobile. It's a mining area where the major part of the outbreak is right now. So people are mobile. They have gone there to work. They will go back to the places they came from. And I would also suspect that we unfortunately will see some cross-border cases, so going into other countries, because as I said, healthcare is not very good in that area, and people who can afford it would probably try to seek better healthcare outside the region where they are now in.
Congo has experienced, the Democratic Republic of Congo has experienced many Ebola outbreaks in the past. Shouldn't it be better equipped to respond to these crises we're seeing today?
So overall, what we see on the ground is that the health authorities are equipped. So there's been quite a massive response from the Ministry of Health overall. People haven't expected that type of the Ebola group virus to come through. So the initial cases, my understanding is they have been tested for other Ebola viruses and has tested negative. What we see actually is that also there's a responsibility of other governments and the WHO, the World Health Organization, to actually invest also in research towards more neglected viruses, such as the strain which is currently causing the outbreak, to be able to respond faster and to have better surveillance in place and a better case detection rate, which would have prevented the outbreak of going so big as it is now.
Christian, thank you very much for talking with us today. That was Christian Katze, Director of Doctors Without Borders, Germany.
Thank you very much.
Our coverage continues now with Caitlin Brady. She is the Danish Refugee Council's director in Democratic Republic of Congo, based in Goma. She joins us now because this is not only a medical emergency, it is also a humanitarian emergency. Caitlin, it's good to have you with us. Let me just ask you, do you think that the world is reacting quickly enough to prevent this outbreak, this local outbreak, from becoming a regional disaster?
I couldn't speak to whether or not it will become a regional disaster, but definitely it is becoming a very large humanitarian emergency for Eastern DRC.
Okay, so I can't. Maybe I'm just not feeling good. Is everything a humanitarian disaster these days?
Exactly.
Is it just me?
Something is. All I can say about this is there's something up with it. I don't know what, though.
Yeah, it's like.
At least that's the sense that I get from everything that's been in the news, right?
Everything's a threat, and the only way to fix it is with money.
Correct.
Oh, yeah, I like. I don't, like I said, I know I've not been feeling great. And I thought maybe my brain was just lagging on something. But it seems like everything. Remember when this college students a few weeks ago wanted to lock down over Hantavirus? Which turned out to be a no big deal, like I kind of suggested. And I know you did too. It's like, this takes forever to become serious. So, like, I don't know. I thought maybe I was just losing it.
I think we might be.
Yeah, because I guess we don't panic at every viral threat, I guess. So, All right, let's hear how bad of an emergency this is. I mean, it's such a bad emergency. It happens every few years, if not yearly.
The primary area affected is one that hosts hundreds of thousands of IDPs, and these are some of the most vulnerable people in the world. They have been displaced by conflict, by violence. They are scared, and they have very little in terms of material goods, very little to fall back on. They may or may not have access to water. They may or may not even
Oh, so the idea of you'll have nothing and be happy goes to show you won't be happy when you have nothing.
Exactly.
Sorry, I had to point that out. And it also goes to show you'll probably be digging in some kind of mine for resources that your government needs while you don't get health care. But hey, communism, right? Sorry.
even have a latrine to use. In that context, it's extremely difficult for them to take all the measures necessary to protect themselves. In terms of the response, it absolutely is not keeping pace with the emergency. The containment has just not happened yet, and we're not keeping pace with the spread of the epidemic.
The situation you're describing is one in which we're seeing people, families that have been displaced. As you said, some people don't even have access to clean running water. I mean, this sounds like the perfect storm then for a virus to take hold and spread.
Exactly. In addition, this is a community that hasn't experienced Ebola before. The other Ebola epidemics that we've had in the DRC, and this is the 17th, have been in other provinces. Ituri has not been affected by and large.
Okay, so Kentucky has never had an outbreak of malaria, but we know what to do if malaria happens. So you mean to tell me that this part of this country doesn't know what to do, even though the rest of the country has been riddled with Ebola over many years?
Right.
Really? They just said these people are refugees from other regions. I'm sure there's a few people there who've seen Ebola and survived. I'm calling bullshit on their entire narrative on some of this. It makes no sense. The entire region doesn't even know what Ebola looks like, and they're acting about it, but yet they're responding. There's the medical getup and the disinfecting stuff. Like, this is what I mean. They want more money, somehow, some way, some form, so they're going to do whatever they got to do to get it. That's really all this is. And
That's what I think.
And they're taking advantage of the fact that there's an Ebola outbreak to do it.
Right. And they've been doing it long enough for over 50 years.
Oh, yeah. Yeah. Okay. How much? Oh, good. Only like 2 more minutes left of this, and then we'll be able to go to the next the next part of this. But I'm really frustrated with the right in front of your face does not match the words they're running their mouths about, and logic doesn't support what they're saying either. So, yep.
Large by previous epidemics. This is a problem because the community does not necessarily trust healthcare workers or the government or people like us when we tell them, this is Ebola.
Video on loop of them doing the same thing over and over again.
You have to do that. You have to present yourself to the health authorities and go into isolation. People are afraid, and when they're afraid, they do lots of things that are irrational. So there's a lot of denial that this is real, and if people are sick, they may deny that they're sick. There will be families who will keep people who are sick in the house rather than bring them to the hospital for treatment, and that's a surefire mechanism for them to then contract Ebola and for the whole family to fall ill.
We know that there have been reports some medical professionals in the DRC have already died from Ebola. And I know that you and the people that you work with are taking all the possible precautions. But I mean, as someone who is there on the ground, tell us what goes through your mind now when you're dealing with providing medical care or others, and that medical care is right now, it seems to be paramount to everything else.
Absolutely, the medical care is the front line. Danish Refugee Council has a protection mandate, and we help and assist and protect displaced people. We do not work directly on health. We do work in water, sanitation, and hygiene. We do work on messaging for these communities. We do work on other forms of assistance. So, for example, we're working with some health agencies who can refer us indigent families who are affected by Ebola, and we can provide them with 3 months of cash assistance. We are also looking at protection, so making sure that services around sexual violence continue, that services for children, including potentially children who are orphaned by Ebola, continue, that education services continue. In terms of our first priority, it is, of course, to protect our staff so that they can continue to work and to develop those tools to make sure that we're protecting the beneficiaries as well while we work. But the second line of defense in any Ebola response is infection prevention
Crazy,
and control.
stop there
And that
1 second.
Uh-huh.
Her pleas sound almost like, give us back our USAID money.
Yeah. But that is because, again, most of that money is going to go to a warlord. That's going to kick them out if they don't provide money.
For all of the money, the millions of dollars of money that has been given, and there's been 220 some cases. Now, it doesn't say how many of those had children associated with them, but I guarantee you it's not the over $100 million the U.S. has given to help that kid.
Yeah. And I'm telling you, it's because most of that money that they claim they're putting towards the kids, a large chunk of it is going to a leader who wants more ammo.
Right. We get that.
And they're probably going to be held hostage or gotten rid of, like we've heard of other healthcare workers. So these people are desperate to pay these fines and extortion fees so they can stay there with their lives and help people.
I'll tell you.
I know. I don't know if it's even worth listening to the last 30 seconds.
I don't think so.
Because all it is pleading for, send us more money, send us more aid.
Exactly. Right.
Yes, if the warlords weren't in charge, I would. Up next, I believe, was this one. Was this it?
I just looked at it. Hold on. It is the... Oh, I'm down too far. That's why. DW News we did writing.
Yep. Next one over was the next post.
So writing the writing the Republic.
Okay. So they're saying, not a simple question, but I will give a long and simple answer. No, a virus that kills the host quickly, like Ebola, does limit how long a living person can walk around spreading it. Wait. What? No, a living I'm trying to understand what she said, because it's not making any sense from my understanding of it. So it says, no, a virus that kills a host quickly like Ebola does not limit how long the living person can walk around spreading it. Actually, yes, it does, because once they're dead, they're not walking around. That's what I was making sure of. She's like, no, the virus doesn't limit how long a host can walk around, but it kills quickly. So, yeah, it does limit how long they can walk around. Has this person got any medical experience? I'm curious. Dee, you still there?
Yes, I didn't know I was allowed to talk.
I'll make sure I mute, and just let me know when you're done, and I'll stop, and I'll talk then.
Go ahead.
Oh, I was muted because I thought you needed, never mind. Sorry. Anyways, I was just pointing out the stupidity of this person. Sorry.
You were checking her credentials.
I was asking about them. Because her first statement, her very first sentence makes no logical sense. That's why I was asking about it.
Well, she's answering a question that is up at the top. Somebody asked her a question.
They didn't ask her specifically. They just asked a general question.
Do you think? And she responded to his question.
So did 20 other people. Let me check out her name and see if she's anything of import. Because that first sentence doesn't make any sense.
Click on her profile pic.
I don't think this is. I don't think she's an actual doctor. What is bioinformatics? And psychoanalyst, as well as clinical naturopathy. I'm calling BS on her. I don't care that there's a blue check mark. I'm calling BS. This doesn't seem right. Oh, she's coming from Brazil. She just joined in 2024. She was verified since May. I don't trust her. I don't. Her first sentence didn't make sense at all. But yet people are going to read this and listen to her and believe it. Because there's a bunch of big words that make no sense when put together in her biography.
Well, why don't you read the rest of it and see if you agree or disagree?
Yeah, we know the body stays extremely infectious for days. In West Africa, traditional funeral rites, washing, kissing, hugging the body. We know that. That's all over the news. You can find that just about anywhere. They say it's an estimated to 20 to 80% of cases in some areas came from unsafe burials. That's not proven. It's estimated. But again, you can pull it from the website like we've done. And yeah, it can devastate any country. Duh. But I struggle. This is all pulled from, from the CDC and WHO websites. But she obviously doesn't know what she's talking about just by this first sentence, which is why she had to copy and paste points, probably from Grok or something else, into the rest of it. Because, again, Do you think Ebola is going to be the next pandemic? No. A virus that kills a host quickly, like Ebola, does limit how long a living host can walk around spreading it. Yes and no. But again, she said, she's sitting there making it sound like it's not going to go far, but then the second and down lower, she's talking about how it's going to spread all over the place because of burial practices and stuff. She literally contradicts herself.
All right, why don't we move on? Go to ABC News.
I thought you were going to take this one. Sorry.
Oh, I'm sorry. I thought you were going to play the video.
Oh, I don't know. I think it's just going to repeat what they've already said. Let's see. Hold on. Is that not the same footage we have seen in every single news output about this?
Pretty much.
They all have the same footage looping in the background?
Probably because they can't get anybody in there. I don't know.
Okay. I'm just really baffled that, like, this is what, the fourth or fifth video in the last few days?
Yep.
That's exactly the same. Okay. I'm sorry. Let me restart it. Okay. So. All right. We'll be setting up a health facility, I guess.
I believe so. We read that yesterday, actually, that they were going to try to set something up.
We didn't go live yesterday.
Or on Wednesday.
Okay. So.
Could have up Reuters next.
This one?
No, wait, hold on.
That's
ABC, right?
Oh, that was from back with, because remember we moved her to the front.
Yeah, okay. Yeah.
Is it? There it is. Sorry.
Yeah. Okay. Go ahead. Why don't you read that, Crazy Bee? My throat's killing me.
Okay. Wait. That looks so freaking familiar.
Yeah, we did that already. We just covered that on the State Department under the Loomer Hickey.
No, not the State Department one. This one. I swear I saw this elsewhere. Oh, it was part of that video that was paused. Okay, sorry. My brain is struggling to work today, and I really apologize. So this is Kenya's approving a U.S. plan to open an Ebola quarantine facility. So I guess we're not going to have to remove people and take them to other countries to treat them then. This is Nairobi. Kenya has promised written approval to the U.S. to open a quarantine facility in the East African nation for Americans exposed to Ebola outbreak. centered in the Democratic Republic of Congo. Two U.S. officials briefed on the response told Reuters the authorization grants and the U.S. access to land and the Air Force Base in that area in central Kenya, one of the officials said. Officials at Kenya's foreign and health ministries did not immediately respond to requests for comment. Kenya had been pushing for the facility to open to all nationalities, not just U.S. citizens. It was not immediately clear if that would be the case. The facility would be staffed by members of the U.S. Public Health Service, a uniformed branch of the Department of Health and Human Services. In a statement Wednesday, Kenya's health ministry said it was in discussion with the U.S. and other global partners about cooperating on the response to Ebola, but did not mention a plan for a quarantine facility. One American doctor infected with Ebola and several other U.S. citizens exposed to the virus have been sent to Germany for treatment and monitoring. Another American doctor who was exposed was sent to the Czech Republic. Okay. So that's good news. We'll be getting extra facilities to hopefully help.
Okay, next is the CNN.
Okay. Oh, it looks like it's watched.
Yeah, proposed US Ebola facility in Kenya sparks backlash at home and abroad. Because of course it does, in Nairobi. The plan to launch this week a health facility in Kenya for Americans who may have been exposed to the Ebola virus has received widespread criticism from both Kenya doctors and U.S. officials working at the Centers for Disease Control and Prevention. Whoever those U.S. officials are, you'd be fired. The main doctors' union in Kenya and the Law Society of Kenya told CNN they oppose the plan, saying it risks importing Ebola into the East African nation, which has no cases as of Thursday. Meanwhile, in the U.S., CDC officials strongly recommended against the plan to send Americans to Kenya, with the agency's acting director. Oh, so Dr. Bhattacharya is the acting director. Oh, that's interesting. Also reportedly advising against it, according to a CDC source working on the Ebola response operations. Some officers at the agency are furious about it and believe the plan will make recruiting and staffing for Ebola response activities harder, the CDC source told CNN. Although the CDC source noted that there are very proficient colleagues in Kenya, they also said it's hard to imagine the standard of care will be able to meet that of the treatment facilities that have been developed at great cost over many years in the U.S., let alone the aspects of wanting to repatriate and closer to family, other supportive services, etc. CNN has reached out to the U.S. Department of Health and Human Services, which oversees the CDC, for comment. A Trump administration official previously told CNN the treatment capabilities at the facility are expected to be able to care for the full spectrum of Ebola virus disease, including critical care needs, though each case will be evaluated for forward transport for more advanced care as appropriate in order to maximize patient outcomes. You know, either I'm really sicker than I think, or the way this is reading just does not make sense.
It's really
The
not.
The outbreak, which is centered in the Eastern Democratic Republic of Congo, DRC, is believed to have caused at least 238 deaths and more than 1,000 suspected infections so far, according to WHO. Driven by the Budabunjo, the
The
BED,
Buttigieg.
the Buttigieg strain, a rare form of Ebola for which there is no approved vaccine or treatment. The virus has also crossed into neighboring Uganda, which has reported at least 7 cases associated with the outbreak, including 1 death. Doctors demand transparency on Ebola facility deal. A senior Trump administration official said Thursday that the U.S. has received approval from the Kenyan government for isolation and quarantine units on its soil. However, the Kenyan government has yet to officially comment on the deal. A 50-bed quarantine unit will be operational as of Friday, another senior administration official said. It will be located on an air base about 125 miles north of Nairobi. As of Thursday, no patients are set to go to the unit. Additional isolation and biocontainment units will be available at the site later. If someone develops symptoms or tests positives, they will be evacuated to other facilities, a senior official said. The CDC and Department of State are working to determine where in Europe those facilities will be located. Care will be provided by officers of the Commission Corps of the U.S. Public Health Service who have already departed for Kenya. Around 30 officers received 3 days of training this week, a senior official said, and more will be trained this weekend. Although there are no approved treatments specifically for this virus, antibody therapies and antivirals, including remdesivir, is that remdesivir? Remdesivir will be available. They only get 3 days worth of training? Okay, I'll go. Yeah, right. Kenya's Secretary of Public Health said on Thursday that the government is having hold on, Crazy B. Where'd I lose my place? Thank you. Having conversation with partners, including the U.S., and insisted that it's taking actions to ensure that every Kenyan is very, very safe. U.S. Secretary of State Marco Rubio said that the Kenyan President, William Ruto, said on Thursday that he is discussing the ongoing Ebola outbreak with the U.S. committing $13.5 million towards its being prepared in Kenya, including securing vital medical supplies. The two leaders agreed to maintain close coordination as the situation evolves and to continue leveraging the strong U.S. Kenya health partnership that has proven essential in addressing public health challenges in Kenya and across East Africa. Another doctor of the, these names, Kenyan Medical Practitioners, Pharmacists, and Dentist Union, told CNN, we need total transparency from the Kenyan government on why they agreed to take up this offer. He also questioned why the Trump administration wants to set up an isolation facility specifically for Americans when Kenya has a long-standing gap in its chronically underfunded healthcare system. What makes the U.S. choose Kenya when the epicenter of the outbreak is in the Democratic Republic of Congo? Asked the leader of the union, which represents more than 10,000 doctors in public and private hospitals. The Kenya and U.S. governments recently renegotiated the amount of aid funding for Kenyan health efforts as part of the new U.S. Global Health Strategy. Under the terms of their bilateral agreement signed in December, Kenya will see a 21% reduction in its global health aid funding from the US over the next 5 years, according to analysis from KFF, a nonprofit health policy research organization. The new agreement stipulates that the U.S. will provide a $1.6 billion to Kenya between 2026 and 2030, with Kenya picking up more of the tab for its own health system, according to KFF. The deal represents a reduction in funding of about $423 million over that period compared to the previous U.S. funding levels. The agreement was immediately challenged in Kenya's High Court, with opponents criticizing it for unfavorable terms. Am I missing something? They're getting
No.
more money than before, but they're complaining. But why are we paying over double the cost, triple the cost? Right?
Well, this
Is
is
that
to
what they're
Kenya, not to the DRC.
right?
They're
The
cutting.
deal represents. This is, I'm assuming the story's still about Kenya. The
Yeah.
deal represents a reduction in funding of $423 million over that period. Yes, no?
Over 4 years, they're going to lose 423 million. But they're
But they're
still getting
gaining.
1.6 billion.
Yes, that's what I'm saying.
Why are they mad?
I'm confused. That means why would we do that?
Why are they mad? They got to pay for their own medical costs, for their own civilians, and their own
No,
people.
I'm okay. Like I said, I'm
Because
running
it says
a
Kenya's going to be
fever and
picking up more of the tab for its own health system instead of us paying for it.
the U.S. We're going to give them between 2026 and 2030
Mm-hmm.
$1.6 billion.
Yep.
Over that time period. Oh, we're going to reduce it from
Probably
down
2 billion.
by 423. Okay.
So it would be 2 billion. We've taken it down to 1.6 instead of 2. Okay.
Now that we learned math again, 1.6 minus 4.23 million is, or plus, we will not sit back and watch Kenya be treated as a containment colony for a lethal pathogen that we did not generate. It is too dangerous for America. It is too dangerous for Kenya. The Katiba Institute, a civil society group focusing on constitutional matters in Kenya, is challenging the proposed American health facility in court.
I have one question. Why did he say we will not sit back and watch Kenya be treated like a contaminant colony for a lethal pathogen we did not generate? What? That's weird wording.
Mm-hmm.
It's really weird wording.
Now you wonder why there's backup crazy bee. Look at that picture of that facility. And that's the best that we could do in 50 years.
Yeah.
No, by the time I ungunned and got my pants pulled down, I wouldn't even have peed and I would have picked something up.
It's... Yeah.
The Law Society of Kenya also asked the Kenyan government to reject the facility. Law Society President Charles Njama referred to Marco Rubio's comments in a cabinet meeting on Wednesday, in which the U.S. Secretary of State said, "We cannot and will not allow any cases of Ebola to enter the U.S." If America, a first world country, is apprehensive about the health and safety of their citizens, we're asking the Kenyan government to have the same standard as the American government does, Njama told CNN. This is quite paradoxical, and it is clearly trying to create a double standard for healthcare system and public safety, keeping America safe while leaving Kenyans at risk of infection. Not our damn country. You need
Well,
us. Let's
their
take our money.
continent. Go take care
Yeah,
of your own
let's
continent.
take our ball and go home. Our ball of cash, that is.
Yeah. But they can
Kenya's
make it without
two large,
1.6 million or
yeah,
billion.
Kenyan's two largest newspapers, the Daily Nation and the Standard, both led with news of the health facility deal. It has also dominated the debate on Kenyan television, talk shows, and radio, as critics expressed disbelief that President William Ruto's government had agreed to the Ebola facility. The widespread criticism also made it off the airwaves and onto the streets as everyday Kenyans expressed concerns about the deadly virus. Please tell the government not to bring those sick Americans here, a security guard in Nairobi told CNN while frisking people entering an office block. I come into contact with a lot of people every day in this job. How will I keep myself safe if Ebola comes here?
I got a question. We did that little report reading. There was like what, maybe 4 Americans that ever got sick, or no, like a couple hundred over the last 40 years, 50 years.
Right.
What are they worried about if it's like a handful over 50 years?
Right.
And yeah, it's so scary. They're worried about a handful of Americans being isolated instead of all the nations being sent there to isolate.
Right.
Seriously? They're acting like we're asking them for their firstborn.
The outbreak is outpacing the response in the eastern DRC. The head of WHO issued a plea on Thursday for an urgent ceasefire in the DRC, where fighting is ongoing between government forces and rebel militias. As the result of the persistent violence, the region is contending with a mass displacement crisis, in addition to other health issues, including malaria, measles, and malnutrition. WHO Director Tedros, who landed in the capital on Thursday, warned that the outbreak in Ituri province, the epicenter of the crisis, is outpacing the response to contain it, calling the situation a catastrophic collision of disease and conflict. We cannot do this work if those who are trying to help are prevented from doing so or put in danger. I am making a direct appeal to all warring parties in this region. Please declare a ceasefire, even briefly, even just enough to let health workers through. A ceasefire, even a temporary one, would save lives. Tedros is in the DRC to show support to frontline health workers and is set to travel to Bunia, the capital of the hard-hit Ituri province, in the coming days. I came here to show that the community, that they are not alone and that we are here to support and we understand their pain, he told a conference on his arrival. He added that introduction of travel bans doesn't help much and may have the negative consequence of discouraging people from reporting their early symptoms.
That's it.
Yep, so we're gonna lie then, everybody that's coming back to the country. I feel fine. Stay here for 21 days. Okay.
And the fact that they're basically begging the warlords to finally give a shit about the people they've never cared about.
Well, I want to know what's transpired the last. Is this, the worst of the worst of the worst? Do they want it to be like, how have we gotten here to?
Well, like when we compare the numbers on the map page that we were showing,
right.
It's not as bad as the other ones that had happened. So why are they acting like this is life and death when we've been through worse.
Don't know.
That's where I'm struggling with all of this. I mean, yes, Ebola, bad, very bad. But it's like the Hantavirus. Also, bad, but really hard to catch.
Right.
And they both are viruses that take a long time to gestate and grow and all that. It's like, I mean, yeah, it's no fun bleeding from every orifice, but a lot of people are surviving. It's only got a mortality rate of 30 to 40%. I mean, if I remember correctly, according to our own news, more people died of COVID than Ebola.
Right, but I thought it had a higher. I thought it was up in the 80s.
No. According to this map over here, this thing, was it this one or was it this one? This one over here. Yeah, hold on. They said it was only a 30 to 40% fatality rate.
I thought we read earlier that it was fatal. That most people, that once it spread.
No, it actually says right here, the Bundibugyo strain case fatality is roughly 30 to 40%, which is lower than the Zaire Ebola virus. It is comparatively favorable with intensive support care.
Hold on. That 30 to 40% lower than the Zaire one?
No, the case fatality is roughly 30 to 40%, lower than Zaire's Ebola virus. So not in comparison to, just in not 30% lower than the Zaire's one, but 30% to 40% in general, which is lower than that.
I thought we read earlier in the week that anybody that gets it is more than likely to die.
Oh, yeah, of course, that's what other news people are saying. But then right here, it's saying it's roughly 30 to 40%, which is lower than Zaire's Ebola virus. And, I mean, the little bar grid thing up here showed it too. Oh, no, it was down lower. Yeah, this is one of actually, it's the third most dangerous. But still, it's only a fraction of the other two if you look at the numbers. And yes, more people might have survived those two because we finally got virus vaccines for them. But still, when you look at it, less people have gotten it than all of these combined. Even though they've gotten treatment, they still suffered from it. Even if they didn't die. But this one, again, I think the numbers were right here. Yeah. The Democratic Republic, there was about, I think they said 17 outbreaks. So since 1976, only 2,738 people have died. I mean, these ones, yeah. It's still, like, you're looking at a fourth of the people for this one. You're looking at about half for this one, 50% in Liberia. And you're looking at about 40% for the DRC. I mean, 800 cases and 322 deaths. That's just under half for that one. This is 2/3 in Guinea. In Sudan, it's a little over half. A Republic of Congo, the other part of the Congo, it's almost a 100% fatality to cases. But that's the other side of the Congo, not the DRC where we're talking. So, I mean, 17 cases and 7 deaths in 2004 in South Sudan. So, is it dangerous or is it not?
Right. we're getting conflicting. Is that why they're trying to gear up a scare?
I mean, looking at these numbers, that's the only thing that makes sense.
But I mean, when it hasn't even traveled throughout all of Africa yet, the numbers don't warrant the craziness that's going on where, I mean, I can see the precaution to have only 4 airports accepting passengers. That kind of makes sense.
Yeah.
But at the same time, that person still, if I'm getting off at an airport that isn't close to home, I'm still going to be traveling, spreading disease if I have it, right? Throughout the region, even. I don't know. That's what got me baffled about this. See, it just is
When you
shades
look at
of.
the numbers, it doesn't match the words coming out of their mouths.
Exactly.
That's one of the issues I've had with this, and the other ones, and the other ones. And I've gotten in trouble for many times because I can look at the stats and say, this does not match. Their own provided information doesn't match what they're saying.
Right.
I don't get it. Like, are we supposed to be like cowering in fear, hiding in a shower? Or like not worried it's not that bad according to their own statistics?
Don't know.
Yeah. I'm kind of feeling that
worse
same
than
way.
Is it way worse than we think? You know what I mean? And they're just not saying.
I mean, even the fact that they lost a month and a half trying to figure this thing out, okay? Let's say it goes all the way back to March. And the WHO lost a month and a half to deal with it. The numbers still aren't nearly as scary as the Sierra Leone ones. I mean, 14,124 cases.
Right, and anybody traveling back to the United States would have already begun to exhibit signs of it.
Yes. We'd be hearing on the news, oh, person found on the street bleeding out their eyes and ears and nose and mouth and bowels and,
They'll probably just blame that on fentanyl.
Yeah, true. There is a fentanyl actually out there right now that is destroying body tissues really bad, but not on the level like what this would do. And again, it's a hemorrhagic illness, not a breakdown of tissue.
Right.
So, I mean, if there was a sign of Ebola in the United States, they'd be rushing to shut us down. At least some would try. Which is why I don't get it. It's like, I mean, they've had months to travel to and from the United States.
Right.
We get people from these areas quite frequently. So, they have March and April and most of May to travel to the United States. Sick or not, they'd be exhibiting signs, at least if it was early case exposure. Now, Trump puts in his order, we got 21 days to see if anyone in America shows any signs. If they don't, then all of this insanity was for nothing except trying to get more money for aiding these countries who are basically just going to give it to warlords.
Right.
Yeah. The system is totally jacked up. I know you've said it a million times. It's really messed up. I think we have 2 more things left on the list. Do we want to just get through them really quick?
Yeah, why don't we? Why don't you go ahead and do that? I'm going to let the dog out real quick since I'm home.
Okay. So the Kenyan court temporarily blocks the US Ebola quarantine. That was as of today at 4 a.m. Is this video for this? Oh, it won't play. Oh. And it's
Team of 30 doctors, nurses, therapists, and more to work at a quarantine site in Kenya with 50 beds set up for Americans if exposed to the Ebola virus instead of flying them back to the United States. But that plan drawing criticism from World Health officials and medical specialists. The Infectious Disease Society of America says it's, quote, deeply concerning and raises serious questions about resources, timing, and the level of care Americans sent there will receive. Dr. Ashish Jha calling it a mistake.
American doctors, American nurses are a major force in bringing these things to a close. Now you're telling them, by the way, if you get exposed, you can't come home.
The administration defending its decision this week.
The State Department and other agencies represented here, the Centers for Disease Control, HHS, others are working very, very hard to contain this crisis to the countries where it's currently located, particularly the Democratic Republic of the Congo.
In just 2 weeks, reported infections now topping 1,000 cases.
There are a few things that set this outbreak apart. One is the momentum. The huge West Africa outbreak that caught the world's attention back in 2014, and which I worked on for USAID, took about 4 months to get to 1,000 cases. And that was really a turning point when it exploded. This outbreak already seems to be at that point.
Now, overnight, the Kenyan High Court temporarily suspending those plans, saying no one infected by or exposed to the Ebola virus will be allowed inside of Kenyan borders. Unclear what that means for U.S. plans at the moment. Meanwhile, screenings ramping up here at JFK and at airports in Virginia, Atlanta, and Houston. Rebecca?
Moving quickly, and they have to contain that. Okay, Matt, thank you.
Whoops.
This morning.
Nope. Pause. So, okay. So the center is maybe. Okay. I think the last thing was this X post.
Okay.
Of those people in that roller coaster in Texas.
Okay.
You sent this over, if I remember correctly.
I would never ride that to begin with, so.
Same. I was just thinking the same thing. But, just getting on it, it's their fault. How high is this thing?
I don't know. I don't know if I want to know.
It says 8 people were left hanging.
Everybody okay? And then make sure that they are calm with the situation. There she is. They just saw her feet come out of the car. 2 rescuers brought her out, carried her down onto the firefighter basket that's up here on ladder number 1. As you can see, she is out, and explained to them that it's going to be a while before we get you down, but we're going to get you down safely. Just bear with us and follow our instructions. Everybody okay?
Yep. That's why you don't ride roller coasters.
Wow.
Mm-hmm. Yep. That's a no.
It's a hard pass for me. That was in Galveston, Texas. Get that on play one more time, Crazy B.
Okay.
And then make sure that they are calm with the situation. There she is. They just saw her feet come out of the car. 2 rescuers brought her out, carried her down onto the firefighter basket that's up here on ladder number 1. As you can see, she is out, and explained to them that it's going to be a while before we get you down, but we're going to get you down safely. Just bear with us and follow our instructions. Everybody okay?
Yeah.
I thought maybe they were going to make them jump in the water.
I would hope not. That would hurt. That'd be like impacting hard ground, wouldn't it, from that height?
You would think. You would think it looks pretty high to me.
Mm-mm.
Yep.
Either way,
Yep.
nah.
Glad to pass.
Yep, that's a hard pass for me too.
All right, people. Well, hopefully, we're just going to update you as needed on the Hantavirus and Ebola. And it's something just to consider what it means for, I think, this country. I have my own personal views on, I think it's great to help around the world, but signed up for it. And so, well, sometimes you gotta live by the sword, die by the sword.
Yep.
And I don't know. I don't know how to prevent things like this from happening. We have our own issue. Heck, we've been battling for weeks now between me and Crazy B and myself, just spreading it from person to person with who knows what. You know, we always say, oh, it's just a cold. It's the flu. It's this, it's that. How do we know what the heck it really is?
I'm
You know,
pretty
I've been
sure
raging
mine's
fever.
allergies. 90. Well, but then I do get a flu here or whatever there because Buddy works at the gas station, so
Right,
he deals with truckers.
right. And who knows where their trucker's been.
Whew.
And I'm rage fevering right now, so I can't stand it. And that being said, everybody, thank you for joining Rex Sisters. Don't forget, next week we will be live 3 to 5 p.m. Eastern Standard Time. Please don't forget to hit the like, follow, comment respectfully, share, subscribe, and hit your notification bell so that you know that we've gone live. And with that being said, I'm done. I'm out. I'm going to bed. Don't anybody bother me at all till Sunday sometime.
You
At
know I'm
all.
going to be messaging you to check on you to see if you're still okay.
I know. I'll check. We'll talk in the morning. You know that.
So, all right. Well, what I'll
But
do
I'm
is I'll
ready.
tell. Oh, sorry. Go ahead.
I was going to say I'm ready to pass that. I apologize. I just have not been myself, and I just don't feel good at all. And it's getting to me.
All right. So we'll go ahead and close out really quick with stay safe, stay sane, stay sober, and we'll catch y'all on the next one.
All right. Good night.
Good night, folks.